Well, good evening, everybody, and welcome to Talanoa series episode 4. I want to thank everyone for joining us tonight. Tonight, we've got a real special speaker or guest speaker to be with us on Alofa Hona's Talanoa. I am not going to introduce her. She's going to introduce herself. But so I'm going to bring her onto screen right now. And she's hiding in the green room, very quite nervous, but I know she will be amazing. Hello!
Hi.
Hi. Well,
I'm
listen,
just
honey, before we start, I'm going to start off with a karakia or a prayer and then we'll kick into it. Let us pray. Heavenly Father, we just want to thank you again for your faithfulness. Thank you for this time that we have to share together. Thank you for bringing Rachel onto our Talanoa session number 4. Thank you for the words that she's going to be sharing and the information that she's going to be sharing that's going to be helpful to our communities. In Jesus' name I pray. Amen.
Amen.
Well, I do want to welcome our special guest star, Rachael Tatafu. And I often say to our visitors or our guests that, before we hear about their role and what they work, where they work, we want them to speak about who they are, who their parents are or were, and the villages and spaces and places that they come from. So I'm going to hand it over to you now, my dear.
Cool. Tapu ki he o toa mafi, whakatapu ki ha ataki lotu, whakatapu ki he kau taki o i community Elephant Wholeness, pea a o atu ai whakatapuni ki ha sola mo ha wulangi o ku tau kau whakataha he hauani. Kia ora ana, ni Sabula, whakalofalahi atu, talofa lava, malo lelei, and warm Pacific greetings. In short and in English, welcome everyone, and thank you, Ros, for providing this platform and forum for me to come and talanoa about myself and what I do for a living. My name is Rachel Fataimo Manu To'anoa Tatafu. Yes, it's a sentence, but you can call me Rachel. My parents hail from the villages for Motu, Holanga Tonga Tapu, and La Paha in the one and only Kingdom of Tonga.
Woohoo.
Um, so I am a New Zealand-born Tongan, born and raised in South Auckland, Mangere, and I come from a big Tongan family of 8.
Wow.
So, yep, including myself. I have 3 sisters, 2 brothers, and a handsome partner. I am also a daughter to Tangiloto and Catalina Tatafu. And yeah, so a little bit about my background in education. So I went to Auckland Girls Grammar, so
Woohoo.
I then went to University of Auckland where I finished my qualifications and then went on to full-time work. So where I've spent the last 2 years, I've been with the agency and I'm here to know a little bit about what we do and yeah.
So in our conversation earlier, it's funny, small world. So Rachel went to school with our oldest girl. So hello, isn't that funny that here we are about to talk about some serious stuff, but Auckland girls always, they pump up some amazing people, don't they?
Well, they definitely do.
Well, my dear, so I guess as you walk into this next part of our evening, you are going to be talking about your role and the particular agency that you work in.
Mhm.
And so I'm going to hand it over to Rachel tonight, everyone. And for those of us who are joining us live, you're very welcome to add some questions or comments in the comment section on the channel, or later on, if you're watching this as a replay, you can always come back on to Alofa Hona's Facebook page and ask questions like many other people have done so. So without further ado, I will pop up your information slide and we'll take it from there.
Cool. Okay, so that slide was supposed to be for my intros, but never mind. Let's go to the next one. So for this one, I kind of wanted to paint the picture of why did Te Aho come to be, or where did we come from? So looking at the graph that I've put up on here, this gives us a clear kind of indication of the impact cancer has on the population in Aotearoa. So on the left, this is the population that's affected in 2018, and then on the right is a probable effect on a population in 2040. So we see a massive jump in the next 2 decades, and we definitely see that deaths caused by cancer will increase, which can mean a lot of things. But the thing we'll focus a lot on is how it means what kind of iniquities will come out and what will it exacerbate. So one another thing why we came to be was cancer was a leading cause of death. Um, in Aotearoa, and I think it still is. Doubling cases are expected in the next 2 years, which I explained before. So in 2018 and then in 2040, cost of cancer care will become excessively expensive for people to have. Um, and there are long-standing persistent inequities. We focus a lot on inequities amongst Māori and Pacific because they have the most significant impact on our population. And lastly, survival improving but slower than comparable countries. So compared to countries like Australia and Canada, we have a similar cancer sector there. Um, their survival is improving, but we are improving at way more slower rate. Um, and yeah, so with all these issues, amongst others, it triggered the thinking and planning of what we have today, Te Ao Te Kahu, the Cancer Control Agency. So at that point of in government, it was seen as a massive issue for New Zealand, and therefore to progress it forward, they suggested a agency that will provide national leadership and influence. Um, Next slide, Roz,
So,
please.
so I guess before we go to that next slide, and so
Yeah.
your role
Hmm.
is what your role in that the, the projection of all of these this data is to promote.
Yeah. So we are trying to kind of control the issue before it gets to 2040. So the Cancer Control Agency is kind of set up to provide assistance for the government to slow down the issue and also provide support and also advice on where we can eliminate inequities. Um,
Mm.
so before this whole thinking and planning stage came up, there was talks about Te Mahere Mate Puku or Aotearoa, which is the New Zealand Cancer Action Plan. Um, this was currently being drafted up in Ministry of Health in 2018 when all of this conversation was happening. Um, so essentially, this team who drafted up the cancer action plan became the establishment team for the agency we now know today. So it turned from a team of 9 to now a agency of 16.
Oh,
Um,
okay.
yeah, it grew pretty fast over 2 years. Um, so in this plan, there were four main goals. One, New Zealanders have a system that delivers consistent and modern cancer care. Two, New Zealanders experience equitable cancer outcomes. Three, New Zealanders have fewer cancers. And four, New Zealanders have better survival, supportive care, and end of life care. So these kind of goals were the driving goals of the agency today. Next slide, Roz.
Sure. I guess, I mean, I'll ask some questions as we go along. So
Yeah.
you may answer them as you unpack your slideshow. I was just looking at what does equitable mean, but I'll let you carry on with this part. So why do we need a cancer control agency?
Right. And because you asked me this question too, Roz, before this presentation, and I had this one already there. But amongst the other things that I talked about was, the issues of of cancer um, becoming, it was exacerbated in 2018. Um, we needed a cancer control to provide national leadership. So prior to that, we didn't. We had a cancer services team within Ministry of Health, which had um, direct reports to different lines of managers, but we
Mm.
needed someone, and not someone, but something
A
that can
body.
provide that leadership, a separate body, um, an oversight of cancer control. So we needed someone that can provide sound policy advice to the government on cancer control, which we currently are doing today. We
Mm.
also needed someone to be accountable for ensuring transparency and progress towards the goals and outcomes of the cancer action plan, not only for 2019 to 2029, but also the ones prior to that. So we needed a government body to control those factors. And that's why we needed a cancer control agency, because that's exactly what we do now.
Wow. And now you're saying that there's 16 of you, is that right?
60.
60.
Yeah.
And they are all around New Zealand, or where are they situated?
So maybe 70% of us are based in Wellington. So
Yeah.
that's our national office.
Mm.
And the rest of us are based in Auckland, um, in Hamilton, Palmerston North, and in Christchurch. Those are our four hubs.
Okay. That's a good spread then, right?
Yeah, so we're spread right across the country, and it's done that way so that we can capture the different issues in different areas.
Mm. Okay.
So launch of Cancer Control Agency. So the agency officially launched on the 2nd of December 2019 with Professor Diana Safeti as the interim CE, and a very small team. So the team from Ministry of Health merged into the agency on that date.
Hmm.
So I think it was a total of 10 people to start up the agency. And we had some key players that helped in this. So we had Dr. Richard Sullivan, who had provided some advice there, as well as Sharon Shear, Dr. Nina Scott, Dr. Chris Jackson as well from Cancer Society, and of course our Prime Minister Jacinda Ardern,
Mm, mm,
smiling
mm.
away, um, and yeah, and also Heya Hurumawai, who was the Māori cancer expert who have supported us along the way as well. Next
I've,
slide, Rose.
I've met Richard.
Yes, that's right. I remember you told me you met him. Did you meet
And
him at the hospital?
I met him when I was taken in to speak to a bunch of people, and
Oh,
he was one of the bunch. But him in his great suits are really his nice suits. That's all I remember. But yeah,
amazing.
interesting. I mean, it's good to hear that he's yeah, um what's the word? Fingers on the pulse. I guess he has to be,
Yeah.
because he's in the lung section, isn't he?
Yeah.
Lung cancer
Hmm.
space. Do you know who the head of Cancer New Zealand is? Cancer Society?
No, I don't at this
Mm,
moment.
mm.
Yeah.
That's okay. That's okay. I just thought he was in that group. Hmm. Te kaupapa.
To Kaupapa, our vision. So, now that we have a new agency, we needed to do some branding and also figuring out what do we want. And we from the four goals that was established within the cancer action plan,
Mm,
we used the wording for it and used it as our vision. So fewer cancers,
mm,
better survival, and equity for all. Um, so that's basically our vision as an agency, is to provide that for Aotearoa and for those people who are going through their cancer journeys. Um, and yeah, next slide.
I just think, I mean, fewer cancers is going to be a massive undertaking, isn't it?
Oh, it definitely is.
Mm,
That's no easy
mm,
job.
mm. Yep.
Um, eh, what was that, Ross?
No, no, I'm just looking at your slide that's on there now.
All right. So our purpose. So what we aim to do is to lead and unite efforts to deliver better cancer outcomes for Aotearoa New Zealand.
Mm.
Our values, we are very much driven by our values. We emphasize this in everything we do. So in all our reports, you'll see these words pop up everywhere. So
Yeah.
we are equity led. We are whānau centered. We are knowledge driven and outcomes focused.
Mm. Which I think everybody is meant to be, right, in the health system.
Well, everyone's meant to be, but some are doing more than others, I
Yeah.
guess.
Yeah. Yeah.
Which leads us to our name, Te Ao Te Kahu, which is as everyone can see, it's a Māori name, and it means the central thread of the cloak. So this thread binds the many strands into one cloak, which provides protection to people and their whānau. That's what it
Mm.
means. And when we break it down, the words te aho means the central thread, symbolizing the agency and its role as a leader and connector across the cancer control continuum. And te kahu, which is the cloak, it symbolizes all the services, organizations, people, and communities that work with those affected with cancer. So our name encompasses the whole cancer control continuum, and symbol of a kahu.
Ah, that's good to know, right?
Hmm.
Because
It's
the
a beautiful
chance,
name.
yeah, I mean, the translation often is just a transliteration, I think is what you call it,
Yeah,
of the word.
yeah.
But the way that you've explained it is, yeah, very, yeah, very good, very good.
Mm.
So, oh, I
Um,
see there. Okay, name gifted.
all right.
Hmm.
So we didn't bring it. We didn't make up the name. Of course, we didn't. And
Yeah,
so we were gifted it by Heiahoru Mowai, which is the Māori Cancer um, Leadership Group.
yeah, yeah.
We work in partnership with them, and
Hmm.
they so that once that relationship started, they decided to gift us this name on June 18th, 2020. So from that day on, we were known as Te Aho o Te Kahu, the Cancer Control Agency, and there was intent for it to be our first name and not Cancer Control Agency.
Yeah. Cancer Control Agency sounds really dark.
Yeah, it does. But Te Ao Te Kahu is really nice. I think it brings a really nice ring to it, and also the meaning behind it. Um, it's of great value, and we do thank Hea Huru Mowai a lot for gifting us a name as such.
I think that's why it should be, it's a kaupapa Māori lens, right? You're
Yeah.
seeing through, you know, from the Māori perspective of what healing is. And I don't
Mm,
know, for our people, it's the same thing. So, and when you're faced with cancer diagnosis, it is life altering.
yeah.
And I know as people think about Talanoa, the Talanoa that has a lot to do with people sharing the clinical side. I've got
Mm,
people sharing from a patient side, but I've not had anyone share from. I guess it's a governmental policy also. Um, I'm not administrative side, but you know what I'm saying. It's sort of
mm,
like those are the big levers in this whole machine
mm,
um, around cancer, and so that's why I asked you on here.
mm,
And I know our listeners will be going, "Oh well, what's that got to do with me?" Actually, it's got a lot to do with us
yeah.
if we are a community that's been hit with this disease.
Mm,
So, and the fact that you looked at a name being gifted the way it has been gifted, it just the
mm,
wider speaks, you know,
yeah.
to us. All right, sorry, dear, I've
Definitely,
interrupted
I
you.
think you brought some great insight to that, Ross, because that's what we wanted, right? Because we were driven on being equity led, and we want to be as kaupapa Māori based as possible. And one of those things is to have a Māori name, and to not only just have the name, but also live and breathe it.
How much does the Māori Health Authority Board? have to do with this agency? Because I mean, I haven't done my background homework to this, but I know
Mm.
that there is a Māori health board, right? Am I right?
Yeah. Yeah.
So how much do they have to have connected to the agency? Do they have any, I don't know, besides, the reps that you have on board? Do they have someone in there?
No, so they don't have anyone with us at the moment, but a lot of the players in Māori House, they all kind of work in the same area. So,
Mm.
so to answer your question, we have a lot to do with them. So as a in-departmental agency, we operate autonomously, but we also operate alongside and partnering with those agencies. So Health
Mhm.
NZ will also be a partner of ours, as well as Māori Health Authority and public health agency as well. And will be working all together to deliver better health outcomes.
Mm. You would think that people would be working together.
Yeah, you'd think they're already working together, but I
Yeah,
think a
yeah,
lot of the cases they're not.
yeah.
Very siloed.
So your structure.
Right. So our structure. So I said before we're independent departmental agency. You're probably thinking, what the hell is that?
Mhm.
And honestly, it's just a fancy word to say that we are operationally our own independent agency. So we have our own chief executive, who was Dice Fati, but we are hosted by Ministry of Health. So our infrastructure is within Ministry of Health,
Mhm.
but we are our own agency. Um, and yeah, that's what it means. So we have one of the things that we do want to emphasize is that we have a direct line to the Minister of Health. So our chief
Mhm.
executive reports directly to the Minister of Health, um,
Who is
who is at the moment, I was going to say Chris Hipkins, but
is
he's the
it
COVID
Andrew
one.
Little?
Andrew Little.
Is it?
Oh, I'm so bad.
You are so bad. You should know who the Minister of Health is.
Yeah, I should. It's Andrew Little. It's Andrew Little. Yeah, so we have Andrew Little, who's our minister. We report
Yeah,
directly to him.
yeah.
It used to be Chris Hipkins, but he moved into the COVID
And
area.
yeah, yeah. And he's the Minister of Education.
Yes.
Mm.
We to our Te Kahu Council, so we have a council as well. They overlook what the agency does internally.
Mm, mm,
Um, we also have our leadership groups, which is our clinical assembly, which is filled with all our clinical leads.
mhm.
They provide us the clinical and technical advice that we need. He Ara Tangata, which is our consumer reference group.
Which I
Um,
was trying to get onto, right?
yes, what you're trying to get onto. And I will let you know when that opens up again because it's a good
Yeah.
group to be a part of. They oversee a lot of our big programs across their agency.
I wonder if I should
Um,
have someone from that group come on here.
that would be great because they have a lot of good stories there too.
Let's do that, Rachel.
Yes, I'll link you up with someone from there.
Cool.
And then we have a Heia Hurumawai, who is our Māori cancer leadership group. They
Mhm.
provide us with expertise in not only in with a Māori lens, but they also have cancer leadership technicality as well that they bring um, to the relationship between the agency and Heihuru Mowai. And we also have a clinical advisory working group. So they're based all across the country that look at specific kind of work streams like radiation oncology and things like that.
There's so much, what you call it? So much, like I'm looking at that model now.
Yeah.
It's pretty massive.
It's huge. So the agency has grown quite a bit within the year and a well, more than a year, half 2 years that I've been there. Um, so before this all had happened, there was no Northern Region Hub for a long
Mm,
time. We also didn't have a few teams as well. So we had the managers for all the teams, but no team. So we've finally grown in, and just to give you some indication of where I was set before. So I was in the national office in the previous role as an equity advisor. So I
yeah.
sat under the equity director.
Uh-huh.
So I was in that team helping out with a lot of government administration work. So feeding memoirs to the minister and all those kind of things. That's where I sat before. But then I moved into the Northern Hub, which is one of the newest teams in the agency. Um, and in this team, I do project management. So I manage a lot of the groups, working groups that happen within the northern region. Um, so, for example, we managed the faster cancer treatment trackers. So we manage their meetings. So they do that a lot to have consistent business rules right across the regions.
Hey, so
So,
you just said something. You just said something, Rachel, that I want to ask before I
mhm,
forget. Did you say faster tracking?
faster cancer treatment
Yeah.
trackers.
So my and I brought this up with the clinicians last week. The high suspicion tracking
Hmm.
system, is that part of the faster tracking thing?
Yeah, it would be part of FCT.
Ah, okay, okay.
So the
And that is practiced right throughout the country.
It's not consistent. So it's
Yes.
different in different DHBs. And it's because the DHBs are independent entities for each region. So there's no kind of accountability to have consistent rules right across. So you find that there's a lot of inconsistency between them all.
So, do you think, as a I guess that's the role of the cancer control agency, is it not,
Yeah.
to align a lot of these things? Because, as you would refer to the numbers and the stats for Pacifica and Maori, a
Mm.
lot of them are presenting late,
Yeah.
or for whatever reason.
Mm.
Um, I know, I know that when was it? So, at that last meeting I had attended, where Richard Sullivan was, they brought up the high suspicion
Right.
fast tracking system. And if you could, you just let our listeners know what the high suspicion fast track is. Let's just say I'm a patient, I go into the GP. The
Yeah.
GP, is that right? Am I right? And the GP
Yeah.
says, "Oh, this person looks like it might be."
Yeah. Then
So
they
then
would
what?
be put on high suspicion and referred into the to a specialist, I think,
Okay,
within the 31 days.
yeah, yeah, because there's time frames, isn't there?
Yeah. And that's what FCT is if they're meeting the timeframes for each DHB. So 31 for high suspicion and then 60 something days for, I believe, I'm not too sure what it was, but it was something like that.
Yeah, yeah. So these sort of things, like, are really important for us to know. That, I mean, look, I can only speak on my own experience going in and not being picked up and being sent home.
Mm. Yeah.
So I went in 2015. They sent me home,
Mm.
even though I had all the signs that it might be cancer. Which
Yeah.
then I went back again, and then my GP said, "You better go get a colonoscopy," which I had to wait for.
Yeah.
Then I finally had the colonoscopy, and by that time it was stage 4. So bowel cancer. And so,
Mm.
hence the reason why I started Alofa Honas. I mean,
Yeah.
on other levels besides doing care packs. But
Mm.
yeah, so when you said fast tracking, I'm really, really keen on seeing that fast tracked, if you know what I mean. Eh?
Yeah. No, and we definitely are too, because we've trying to crack a whip on it for a long time, but it's yeah, one of those things that it takes a lot more than actual meetings. There's a lot of work that needs to happen as well. And
What's the problem?
it's a lot of it is technical problems. So the data that's not coming through as they should. So that's a lot of the issues around the FCT stuff.
Yeah, it could save lives though.
Yeah, I know. It's so weird because when you sit in those meetings, it's like, oh yeah, yeah, I don't know what they're talking about. But then again, you think to yourself like, this small thing could save someone's life.
This could save someone's life
Yeah.
to be, and I can only just speak from my own experience of
Mm.
being overlooked and not being picked up when
Yeah.
I had gone in and requested. I was in hospital, literally in hospital,
Mm.
bleeding, right? And so being sent home and
Mm.
said it was a stomach digestive problem all the while. Hello, it was flipping cancer. So
Oh
yeah,
gosh.
I think your role. I mean, there's an inequity of access
Mhm.
for the patients, but the process sounds really. I mean, if I'm from what I'm listening to, they're like you're really trying to push this. It's not uniform across the nation.
Mm.
Well, that's why you're there, eh?
Yep, and that's why we're having the restructure. And I think that's what a lot came with the system reform
Mm,
review that came before, was that there's just too many inconsistencies right across the country, and we needed one entity to kind of control it all, which is why we're going to have Health NZ, right?
well, hopefully.
Hopefully.
Yeah. So you were talking to the. Sorry, I interrupted you, but remember I told you I might interrupt you. So you're up to fast tracking. That's what you were up to.
Yeah, the faster cancer treatment tracking. So
Mm,
that was so that's the kind of things we kind of deal with in the Northern Hub region. So the projects are quite different from a national versus a regional perspective. So we do a lot of work with the HBs, whereas our national team do a lot of work with government. Um, and yeah, that's just really how our agency works. We work alongside NCCN, who also look at child cancers, and AYA, who also look at adult and young adolescents. So we have we have an eye across the whole, you know, life of cancer, from young all the way to the older population.
what does NCCN stand for?
National Child
Child cancer.
Cancer.
Ah,
Don't know
okay,
what the N is for the,
okay.
yeah.
You know, I mean, just looking at the governance model and looking at the different, you know, departments or
Mm.
regions where these are happening, man, you need a cancer control agency, don't you?
Yeah, we do. We didn't have it before, so now that we do have it, it's we're in an odd place where it's like, if we go, who's going to do everything we're doing now?
You
So we
can't go,
definitely need
Rachel. You can't
them.
go.
We can't go. No, we can't.
You got to stay there, you know.
Yeah.
All
Next
right,
slide.
next one.
Cool. So cancer and Pacific peoples in Aotearoa. So I'll give you a quick review on what's affecting our Pacific people in Aotearoa. So Pacific peoples, as you know, experience higher incidence and mortality rates of
Mm,
several cancers. They suffer more from cancers associated with infectious agents, such as cervical, liver, and stomach cancers. There are five most common diagnosed cancers among Pacific, which are breast, prostate, lung, uterine, and colorectal. So with the uterine one, it's particularly endometrial, which
mm,
Seth and I talked about last week. Um,
mm,
which is good you brought it up, because it's a massive inequity happening right now in the Auckland
yeah.
region. Um, there's also the five common causes of cancer deaths, which are lung, breast, colorectal, stomach, and liver cancers. So cancer survival is poor for Pacific. Pacific women particularly have poorer breast cancer survival rates due to late diagnosis, like we talked about before, Ross.
Mm,
Late diagnosis is a massive problem amongst the Pacific population. Also, differences in access to and quality care after diagnosis. So those things are missing from our Pacific people's cancer journeys, and it's
mm,
something that we need to provide more advice and work in as well.
mm. I mean, look, if there's one diagram that I've seen for the last four Talanoa sessions, it's this one.
It's from our not our cancer action plan, our state of cancer report.
Yeah. This is the one that they all the clinicians have put up,
Mm,
and
it's
I
mind
look.
blowing.
It is. I mean, I look at the mortality. Hey, I mean, look at
Mm,
it. It's pretty bad
yeah,
on each one, bar colorectal in
yeah,
terms of mortality rate, but the uterus one, oh my gosh.
yeah. It's honestly mind blowing. I think I because I don't come from a health background, so just coming
Yeah,
into this and
yeah,
knowing what's happening around us, it's crazy to know that the cancer that's having the biggest inequities is uterus, which affects only our Pacific women.
yeah. And having clinicians, and if you just jumped on and you never saw last week's one, I suggest you go and watch last week's one because Dr. Okasini and Dr. Ponapalam um, have been tasked with the humongous,
Mm,
um, purpose to deal with endometrial cancer. And I learned a lot last week because I thought it was connected to cervical, but it's not. So endometrial is the lining of the womb, and so they talked
mm,
about that. And what's alarming is it's affecting women under the age of 50,
yeah.
Pacifica women. And so the message came out clear last week was around women's health, and women's health needs to be right at the forefront.
Mm,
So there was a really beautiful, not a plea, but a real beautiful message by Dr. Augustini to not only just to the community but to the government, to
mm,
the powers that be to provide more funding in the area. But yeah.
yeah. Well, definitely. It was beautiful talk last week as well, and it was good to hear that awareness about these things. But yeah, let's crack straight into a cancer prevention report.
Mm,
So this report, I wasn't actually part of this project, but I do know a lot about it because our team were tasked to provide an equity lens over it. So
mm,
the purpose of it. So the report outlines evidence-based best practice interventions to prevent cancer across 6 key cancer risk factors,
yeah.
um, which they highlight quite vividly. Oh, it's on my next slide, but it's fine.
Oh, okay. Oh, next one.
Um, no, no, just stay there.
Yeah.
So it summarizes how Aotearoa is doing in addressing each of these factors. And in doing so, it aims to place renewed value on strengthening cancer prevention work to achieve the goals of fewer cancers, better survival, and equity for all. So we quite often weave our vision through all of our documents, and
Mm,
you can definitely hear that coming out. Um, so this report, we provided a supportive role with a strong cancer lens. We also provide technical credibility for this report. So what that means was we provided all the clinical advice and also the public health advice that came with it. Our team, not everyone knows this, but are full of public health physicians. So
wow.
um, we have a lot of public health physicians and also ones that are training to and within our agency, and they provide a great lens on how we can approach public health issues such as cancer prevention. Um, and yeah, so this report provides connection between risk factors and the amount of cancer they cause.
Mm,
Um, it also provides evidence-based interventions across the 6 areas, which are tobacco, alcohol, poor nutrition, excess body weight and insufficient physical activity, also excessive exposure to ultraviolet radiation and
mm,
chronic infections. So those were the key areas we looked at, and I think to highlight from that, Pacifica and significantly impacted with 5 of the 6.
yeah.
Yeah. So all 5 of them, except for the ultraviolet radiation, which predominantly affects the European population,
Mm,
is the only one that doesn't affect Pacific. Um,
mm,
So yeah, basically in this report, we talked about what are we currently doing in Aotearoa, what could we be doing better, um, and we talk a lot about what we could do better because that's what we do. We provide that advice and how we can better cater to our people in Aotearoa who are going through cancer, the cancer journey. Um, in this report, we partnered up with Te Hearinga Hauora, which is the health promotion agency, and the public health unit at University of Otago, Wellington, to draft up this prevention report. Um, and yeah, so I think in the beginning of this report, Pūrongo Arai Mate Pukupuku, um, we wanted to enforce the te reo and also the te ao Māori that comes with our name. So with all our reports, we always provide a Māori whakatauki. And we want to start this one off with foster the pathway of knowledge to strength, independence, and growth for future generations. So we just wanted to emphasize that prevention is not about now, but it's about our future. It's
Mm.
talking about our whānau to come, and we want to provide a space now to have awareness of prevention so that in the future we don't have this issue that we have in the future. Um, so yeah, next slide, Ross.
I wonder, I mean, look, I don't work in the, oh, okay, cool. I like that. I wonder, um, prevention is in every field of health, right?
Yeah.
And it's a question that I put to all the clinicians that have been on here.
Hmm.
It's the same factors in every health issue. It's
Yeah.
obesity, it's poor nutrition,
Yeah.
exercise, lack of inequitable access to
Mm.
whatever that might be. And I said this to them last week. I said, "Gee, you all share the same, but you all share the same factors with the
Yeah.
same community, and yet." I think you said it yourself. It's so siloed. It's not funny. Yeah, but we're all, I can only, I mean, I'll go back to me when I got it in my bowel,
Mm.
right? So it was stage 4 in my bowel. So I had the bowel surgeons, but then it went to my liver. So then I had the liver surgeons. And
Hmm.
then in 2018 or 19, it spread to my lungs. So then I had the lung surgeons, and I totally understand around different parts of the body having different clinicians.
Mm.
But cancer is one disease. I mean, I'm not a doctor, but
Mm.
it's the abnormal cells, things that are going wrong.
Yeah.
If the factors have been identified as the 5 out of the 6, shouldn't there be somebody or somewhere that's going to go, oh, it's the same thing right across the board. Let's come
Yeah.
together and tackle those 5 areas.
Mm.
And then otherwise your resources are depleted because let's be honest, if I'm working in Southside, that's
Mm.
where it's happening, isn't it? Sorry, interrupting your slide again.
No, it's totally fine, and I totally understand it because I also have my frustrations against the silo systems as well. Because it creates barriers and inequitable access for our people at the end of the day. Um, but yeah, let's get back into this. Why is
Mm,
cancer prevention important? It's very important. I think everybody knows that. Um, But I think from this quote here, no country can afford to treat their way out of a cancer crisis. That is so true. It's expensive, and
yeah,
just to
yeah,
put some dollars
yeah.
on machines, it costs millions of dollars to set up a Linux machine, which provides radiotherapy. Right, that times how many across the country, we just can't
Mm,
afford it. And I think it's important to understand that because if we coming to a crisis, a cancer crisis, we need to know that it's an expensive disease to treat, and not only on an individual level, but also on the country level, right? We just can't afford it. Um, so this is why it's important. So we have up to half of all cancers can be prevented. So, and there's also a way to get out of this is just with prevention. That's why the prevention report's important. We it is also ideal that it also is ideal in cancer control. So the work that we do at the agency is to control these things. Burden of cancer is not the same for everyone.
Mm.
Um, it's should be environment focused and not individual focused. Cancer prevention is sustainable, it's cost saving and resilient against crises. And yeah, preventing cancers prevents other things too. So there's other diseases that could be prevented with the things we do in cancer prevention.
Mm.
Obesity is one of them. Um, and yeah,
Mm.
that's why cancer prevention is so important. It's gonna save us money as a country and also gonna save lives.
So
Cool. So what's in
that's
it? What's in it? So these are the 6 key areas that I talked about before,
mm.
and that's what the report is based on. This is the foundation of it. So each section focus on major cancer risk factors. So for each cancer risk factor, we answer the following questions.
Yeah.
Um, what is the connection between the risk factor and cancer? How big is the problem of exposure to the cancer risk factor in Aotearoa, and how can we reduce exposure to the cancer risk factor in order to prevent cancers? So those were the 3 big questions we asked when doing this report. And in each section we asked that. Um, it also has an assessment of how Aotearoa is doing in each of these areas, and we also highlight how can we do better.
Mm.
Yeah. Next slide.
Yeah. That's what all the clinicians have been saying, eh?
Mm, yeah, definitely.
Mm.
So what are we hoping to achieve? I think the 3 key areas we wanted to look at was highlight the role that environments play in cancer, um, and cancer prevention, provide a suite of evidence-based options that government can choose from to act on. So we provided a list of options for the government, our government, to that they can, crack along with. Um, we also provide this to the minister, and I think they're also thinking about what are the next steps in this area. And 3, work alongside the Ministry of Health and public health agency as needed in areas that government is keen to progress further. So working with our partners to carry on what we provided as evidence in this report.
Mm. Highlight the role that environments play
Mhm.
rather than focus on individual behaviours.
Yeah.
So environments, do you have an idea what like we're talking about home environment, work environment?
I think we're talking in this area, I think we're talking like socioeconomic environments. So,
Mm.
for example, South Auckland is an environment itself, but it's very much different to like say Remuera, right? There is alcohol outlets on every corner, fast food outlets on every corner, whereas Remuera doesn't look like that. The structure of it is quite different, and I think a lot of it we need to focus on how we can fix environments rather than individuals.
Mm.
Um, because I think the environment is the most important part, right? They're the ones that play into the different risk factors that happen to an individual.
How do you see it? What you call it? How do you see it? You know, any any movement in terms of environment?
Slow movements, I guess.
Mm.
I think a lot of it is it's actually very slow. Because we as an agency can provide as much advice as we can, but it's up to local government and also regional government to be alongside us within policy.
Yeah.
And sometimes it's not the case. And we do come back to those siloed kind of systems again.
Mm. So your current role,
Hmm.
eh,
Yeah.
um, are you seeing shifts in mindsets around, you know, equity space?
I definitely think there's a lot of shift in the equity space, specifically for Maori and Pacific, because that question reminds me of that one you asked about how do you see the cancer control agency working towards creating equitable access?
Mm,
And I thought about like one of the values in the agency that I mentioned various times that it's equity led.
yeah.
We produce advice and influence that is focused very much on equity.
Mm,
Um, and at the moment, the agency has been focusing a lot on Māori and Pacific through different ways of collecting
mm,
data. So we've gone out and did 30 Māori hui, which we did last year, and are
wow.
currently drafting up a report that was specifically to hear Māori and whānau's cancer experience
Mm,
right across the continuum. We're also doing some work with a Pacific research group, which you know of, um, where we're holding focus groups and also one-on-one Talanoa to hear Pacific families' cancer journeys, so that we also just hope that this is a foundation of future work to make the cancer pathway accessible. I think our first step of before doing anything really is to understand what we're dealing with right now. What's the current situation for Māori and for Pacific, and from then this is kind of setting up that foundation to what advice we can give to the minister on how we can create equitable access.
can you just, in case there's someone listening, which I know there is, that research that you asked me to find people for,
Mm-hmm.
did you want to plug that tonight?
Yeah, sure. I think it's a good opportunity too. So we're currently doing a research project with Wana Research. We're looking for cancer patients who have had cancer or been diagnosed in the last 2 years, above the age of 25, to come and join. We've got a few spaces left, and we would love to hear your story on your
Mm,
cancer journey. We specifically want to hear what were some of the issues you had along the way, just so that we know as an agency what are people experiencing in the cancer journey and where are the barriers that are holding up opposite people from getting to their cancer treatment. And yeah, if you are keen to join, you can get my email address off Roz, um, and we can talanoa more about that when you get in contact with me.
well, you thought that you couldn't talk for more than 20 minutes. It's nearly an hour. So I
I
just wanted to
know.
say that, hey, listen, I want to thank you for coming on tonight. It's a real blessing to have someone such as yourself, young person in that space, who knows what she's talking about. And part of that is having a voice. I mean, your family should be proud that you were in that place of the
Oh,
Cancer
thank you.
Control Agency, because you are one of the threads, isn't it? We talk about
Mm. Yeah.
the meaning of Cancer Control Agency. It needs people like
Mm.
yourself to be able to act on our behalf. So I guess on behalf of all of us who, I look at the structure that you showed, and my gosh, how many different
Mm.
DHBs and groupings and you name it. And there's the little old you, and an agency that's just been formed. Hopefully, it's going to make a difference for us. It's going to be, at the end of the day, prevent.
Mm.
Prevention is the word for me, which is why I'm doing this Talanoa, is to get
Mm.
it out to our community around, um, you know, we have the power to heal ourselves. And that's really about making wise decisions on what we eat, how we,
Mm.
exercise, the way we think about things. And I do want to thank you, Rachel, for
Oh,
coming
thank
on
you, Ross, for
tonight.
having me.
No, it's cool. Hey, don't worry, I'm going to get you back again. But I'm mindful that I think your partner walked through the door earlier on. Just
Yeah,
seemed
he
to
was like,
know.
"Are you finished yet?"
Look, see, Dr. Perolini's just said, say Rachel, great
Oh,
Talanoa
whakatā,
session, love the
Olivia.
mahi. Yeah, she's amazing, eh? And so, yeah, I just wanted to say thank you. Malo Opito for coming on tonight. Thank you to your family for letting you speak in this evening. And, we want to get the word out about
Mm.
prevention and awareness. As we are people who know how um, to live and enjoy life, but we want to enjoy life to the fullest,
Yeah.
which means making wise decisions, on
Mm-hmm.
a whole level of things that we can, make calls on. But
Yeah.
we're gonna rock out this evening because I often say I ask my guests what their favourite song might be, or maybe a song that uplifts them and at times, or brings some great feelings or thoughts. So
Mm-hmm.
I'll get you to introduce the song, and as I after you've introduced it, then we will sign out and let the listeners rock out to your music this evening.
For sure. So this song is by Connects and J Black. It's called Mate Ma'atonga after our very good rugby league team. It's a little bit biased, but anyway. Um, this is my favorite song. It shows who I am as a person and how proud I am to be Tongan. This is dedicated to the Tongan community of Fatu.
What's the song called? Mate
Um,
Ma'atonga.
yeah.
Okay. Keep talking about it because I'm trying to find it.
um, it's a very hip song. A lot of the young people are listening to it, and it reminds them very much of the Rugby League World Cup that happened in 2018, where the parades were happening all over Otahu.
So as I flick this up, which I've found now, as I flick this up, listeners, uh, we often found. Oops, I'll just turn it down a bit. Often found um, the red and white flags all over the place, during the rugby league time. But I hope that as our people listen to this song and as they go out, that they will be waving a flag of health and
Mhm.
well-being. Okay? So thanks again, Rachel. God bless you,
Thank
my
you.
sister. No doubt we'll catch up again. And
Yes.
I know that the Lord will continue to bless you as you bless others. Malo
Malo
Opito.
Pito, Ofatu.
Goodbye. See you later. See everybody. Next week we've got bowel cancer person coming on board. She'll be talking about bowel cancer and how that's affecting our Pacifica communities. But in the meantime, have a wonderful end of April. Let's rock out to Mate Ma'atonga.